After an ACL injury, there's two different treatment options, surgical and non-surgical. But which is better? Hey guys, it's ACL Physio. Today we're going to look at different misconceptions people may have regarding the treatment options for an ACL injury. Okay, let's get started. Misconception number one. Okay, so we have two different treatment options for an ACL injury. We have surgical and then we have non-surgical. And there's actually only one high-level study comparing these two groups. And this study found no difference between the groups in the long term. People usually think that ACL surgery helps you heal faster from the injury, but actually that's the other way around. If you head into the surgery, you need to respect the healing process of the ACL graft. But if you take the rehabilitation only, then you can progress much faster with the rehabilitation process. One of the misconceptions people may have is that the treatment option should be selected according to the injury type. For example, if you have a completely torn ACL, that would require surgery, and if you only have partially torn ACL, you could be able to cope without surgery. But that is actually not the case. Some people may have instability symptoms also with partially torn ACLs, and some people may have fully functioning and stable knee also with a complete ACL injury. Meniscus injuries come quite often along with an ACL injury. Another common misconception is that if you also have a meniscus injury along with your ACL injury, you would need surgery. But again, that is not the case. Some meniscus injuries can also be treated non-surgically. What I hear quite often is that people are told that if they don't do surgery on their knee, their risk for knee osteoarthritis and future meniscal problems increases. But again, that is not true. Unfortunately, whenever you have an ACL injury, your risk for knee osteoarthritis increases, but that is not dependent on the treatment. What I also come across quite often is that people say that they ended up having surgery because they were told that they are not able to return to high-level activities without having surgery. But again, that is incorrect. There are many examples around the world of professional athletes who have returned to their pre-injury level without surgery. For many years, researchers and clinicians have debated if ACL can regrow. There has been some studies showing that the ACL, so the ligament itself, has a potential to spontaneously heal. But there isn't any scientific consensus on this yet. But as mentioned before, the treatment option should be based on whether you have instability feelings or not if the ACL has been healed or not. In the long term, there isn't better or worse treatment option. It's not like surgery is always better or rehab is always better. The treatment should be selected with your orthopedic surgeon, with your physiotherapist, and it should be based on whether you have instability feelings in your knee or not. I hope you guys enjoyed it. If you have any questions, leave them in the comment sections below. Please subscribe to the channel, and I see you guys in the next video.